And in the studio to discuss COVID-19 situation report in states is Dr. Teresa Mwachukwu, Deputy State Epidemiologist, FCT. We thank you for joining us this morning.
Thank you very much.
And seated in our MENA studio is Dr. Muhammed Makun Sidi, Commissioner for Health, Niger State. So you're welcome to Good Morning Nigeria.
Good morning, Nigeria. Yeah, good morning, Nigeria. All right, and then joining us via Skype from Gombe is Professor Idris Muhammad. He is chairman of the Gombe State Committee on COVID-19. Prof, a pleasure to have you with us on Good Morning Nigeria.
Thank you very much.
All right, well, let's begin the conversation with you, Professor Muhammad in Gombe. Tell us, I mean, it's been about 4 weeks now since we last took situational reports from the various states, but we have also seen the geometric rise in the number of infections and also fatalities arising from COVID-19. What's been playing out in Gombe State?
Well, as you probably know, about 3 weeks ago, we had a member of the task force who was found to be positive with COVID-19. And he also happened to have been a director working in the government house. So because of that, we decided to close down the government house and test everybody working there, including every member of the task force, their relatives, friends, and associates. And so for that reason, we tested over 3,600 people, out of which we got 250 positive. So that explains the spike that you are talking about. The spike came as a result of massive increase in testing. And that goes to show you the importance of testing in COVID-19. Because unless you test people, you will not know the extent of this infection in the community.
All right, so we're going to continue with you. You said that the spike, the results that you have now, is due to the increase in testing. That is one. If massive increase in testing is yielding results, it then means that many people in that state have not really realized that COVID-19 is a reality. Now, how much of a sensitization is going on in that state, especially at the lower level? Like what I mean here is at the level of communities who live within the city and outside the city. So what is the government doing to increase the effort geared towards making Nigerians in that area know that coronavirus is not a hoax?
Massive testing is, of course, only one aspect of the problem. The other problem is that there has been community spread, as we discovered about 3 weeks ago. People who have never traveled out of the state were found to be positive for COVID-19. As you imply, there's probably lack of awareness amongst the community. And this is true not only of Gombe State, but of the whole country. I know that my colleagues in other states, and as well as the Presidential Task Force, have been worried about the fact that people tend not to stick to preventive measures against COVID-19, either out of ignorance or nonchalance in some cases, I must say. We have been going out into the community along with the community leaders, the traditional rulers, the religious leaders, and generally community leaders, to explain to the people the need to understand that COVID-19 is real and that there is no need to entertain any fear in being tested. And there should be no stigma under any circumstances, because this disease is not a disease that you acquired like HIV. This is the disease you acquire from inhaling air that is contaminated with the virus. It's none of your fault that you enjoy the air that God has given you. And if you happen in the process to get COVID-19, there is no shame in it. If you catch COVID-19, you are tested and you are found positive and treated. When you are negative, you are just normal like any other person recovering from, say, malaria or even gastroenteritis. You are normal. There is no need for people, there is no need for stigma of any kind. So talking about getting people aware, it's one thing to make them aware. It's another thing to make them comply with the regulations put in place to protect them. Unfortunately, some Nigerians, even if they are aware of the consequences of the infection, they do not show the right level of commitment to protect themselves, like hand washing, like sanitizer, but particularly use of face masks. People seem to be averse to the use of face masks, and I just can't understand why this is so. Maybe it is the minor inconvenience of having to cover your face and breathe through a cloth or a face mask. But that's a minor inconvenience compared to getting COVID-19. So what we've been doing in Gombe State is to keep pressing that these measures are necessary to protect Gombe State from being very ravaged by the virus. Because the virus does not respect your social status, doesn't respect your sex, your age, or whatever. So we, in this undertaking, we've been calling on the media to help us spread the message within the community. And it seems to be working in Gombe State because of recent, we have had people coming voluntarily to the testing centers, asking to be tested for COVID-19. And that's an improvement.
Well, Professor Idris Muhammed, I mean, your Skype connection is so clear. We want to quickly take advantage of it. Just pop in this last question before we go over to the other guest. You say that 3 weeks ago, once you embarked on what we shall describe as an aggressive testing, you identified some 200 persons who were positive. How capacious is the state facility in taking in these persons who have tested positive and are probably also undergoing treatment?
You mean testing facilities?
Testing and treatment facilities.
We don't have a testing center in Gombe State. As you probably know, we've been trying to get one for the past well over 2 months. We have procured our own PCR machine, and we're waiting for the NCDC to come and set up the laboratory and accredit it before we start testing. If we had a testing center of our own, I assure you that the level of testing in Gombe State will far exceed that in other states, with the possible exception of Lagos and the Federal Capital Territory, and maybe Ogun, states like that. But this ramped-up testing that I referred to took place despite the fact that we did not have a testing center in Gombe State. We still have to send our samples to VOM or to Abuja to be tested. And that's a problem. Because sometimes, I mean, it's at least 500 kilometers between here and Jos. I mean, here and Abuja, and 300 kilometers to Jos. So it's a hassle getting your tests across to those areas. That if the samples arrive there in good shape, you can get a false negative or a false positive result if the container or the condition under which you take the samples are not right. So I wish we will have our own center, but I think we will have it pretty soon.
Okay, well, that's a good note that they're expecting to have one soon.
Yeah, except
right.
that, well, we'll return to him. The question
of
when I asked, I said, look, you have 200 persons who tested positive. What happened to those 200 persons? Were they being treated in their homes, or did they get into isolation facilities? And how capacious are those isolation facilities? We'll return to Prof later.
I think yes, he's going to explain that as we make progress in the program. Now, let's go to...
All right, you're welcome back, and it's still Good Morning Nigeria live on the network service of the Nigerian Television Authority. Let's return to Gombe via Skype, where Professor Idris Muhammad is still with us. Professor Muhammad, again, we have to apologize for the snags that we have experienced in reaching back to you. I just would like you to tell us, in addition to what you have for the treatment of the patients in terms of the availability of centers. Let us also have an idea. We have reports from different parts of the country that health workers are also being infected, and this is causing some resistance, in terms of their willingness to begin to take care of patients. What's been your experience in Gombe?
Let me start with the issue of workers. Luckily, we have very few health workers being infected with COVID-19 in Gombe State. So far, we have had less than 10 health workers of all categories being infected. Unfortunately, we lost one doctor amongst them, but the others have recovered or are being treated successfully. The health workers are being paid as and when due, and we have had no problems with them in Gombe State. As for isolation centers, we have 6 isolation centers, active isolation centers in Gombe State. 3 are in Gombe or within 10 kilometers of Gombe. And there are 2 in Bajoga, which is about 70 kilometers away. And there's 1 in Kaltungo. So we have 6 with a total bed capacity of over 400. As of now, I know about the time I was about to finish my last intervention, one of you was trying to ask what we did with the 250 positive people. As a matter of fact, many of them were able to self-isolate at home. As some of them made clear publicly, there were 5 legislators infected and 4 commissioners, state commissioners, and 1 special advisor. All these were able to self-isolate in their homes. And we visited the homes to be sure that they could do so before allowing them to self-isolate. As of yesterday, we had only 70 people on admission. So our 400-bed capacity isolation centers are mostly lying fallow as of now. So our capacity is quite good, despite the fact that we have ramped up testing, and we intend to do so. What's happening is that the cases we're discovering them early enough so that before they become symptomatic, so that most of them, the great majority of them, 99% of them, are able to recover and return home healthy. Or when we have to admit them to isolation center, they spend the minimum number of days before becoming negative and being discharged. So we have no problem with isolation facilities in Gombe State as of now. I don't know what will happen in the future, because my hope is that we will have our own testing center within the next week or 2, and then we shall ramp up testing. At the moment, we have tested about 5,000 people from the beginning of the pandemic to date. If we had our own machine, we would have tested many more people. And the downside to you test, the more positives you will get. And we have had people complaining there are too many cases in Gombe State. Well, there aren't too many cases in Gombe State. We were able to discover many cases because we did a lot of testing. And testing is key in the control of this pandemic of COVID-19. Testing is key. I cannot emphasize it sufficiently, because I know that many people are averse to being tested because they don't want to be labeled as having been COVID positive because of stigma. And that's another issue that we need to face in this country. There's absolutely no need for stigma regarding COVID-19 infection. It's like malaria infection. It's like if you have typhoid or gastroenteritis, you recover, you are well, you are back to normal. So there's no place for stigma, there's no place for complacency. We appeal to people to come forward for testing in the understanding that when they are positive, they will be taken care of. And as you know, one of the problems is that when you isolate people in this time of economic hardship, they complain to you that their families are not being catered for. We in Gombe State, the government has set up a palliative committee headed by the chairman of the Gombe State Council of Emirs and Chiefs, the Emir of Gombe himself. And they've been distributing palliatives to those needy people in addition to those who are isolated in the isolation centers. So we have no problem in that respect. And the only problem we have is that in a few areas, when our rapid response teams turn up to trace contacts of those who are positive, they are chased away. And
all right, you've just nailed it. That Nigerians should, not pay attention to some behaviors that will be inimical to the fight against the virus. You don't have to isolate yourself from somebody who has come out of the virus, somebody who has been successfully treated. I wanted to ask you a question. If you can answer that in 1 minute or less. Many people are not happy about how patients are being treated at the isolation centers. At some point, we had some patients who protested, publicly on how they are being treated at the center. Some said, look, they had to drink Gary. Some said, look, they only give them just vitamin C, and nobody caters for them, and all of that. It went viral as at that time. I don't know what the situation is in Gombe, because I know that at Gombe also, some people there also protested then. Has it improved? That is the way patients are treated at the isolation centers. In few seconds, please.
I have heard that complaint before. I can assure you that this is not the case in Gombe State. We had an isolated incident at the beginning of this pandemic when some people in one of the isolation centers just outside Gombe came out on the streets to demonstrate on some very flimsy excuses. I know one of the excuses was that they were not giving adequate food. And they also said that they had no medication, which is not true, and that there were no doctors. At no time did we leave any of our isolation centers without 1 or 2 doctors, usually 2 doctors. And the single incident I'm referring to was solved within 24 hours. And this was well over 6 weeks ago. Since then, we have had no problem whatsoever with people we isolate complaining about lack of care. In fact, they watch satellite television in the isolation centers, and they are given the best food possible. So far, so good. We have no complaint in Gombe State.
All right, Professor Idris, we do hope that people will take the precautions and then follow the protocols appropriately. Dr. Theresa Wanchuku, Deputy State Epidemiologist of the Federal Capital Territory, thank you for being with us on Good Morning
Thank you
Nigeria
very
today.
much for having me.
From Mina, Niger State, we're joined by the State Commissioner of Health, Dr. Muhammed Makunsidi. Thank you very much. You see him there in the middle of your screen. And on the right side, via Skype from Gombe, Professor Idris Muhammad, who is chairman of the Gombe State Committee on COVID-19. Prof, I delight having you on Good Morning Nigeria.
Yeah.
Thank you. It's my pleasure.
And that's the end of today's edition of Good Morning Nigeria. We thank you so much for being part of it, and we'd like to see you again tomorrow. My name is Kirin Umayo.
Stay safe and be well. I'm Kingsley Osadono.